Very good evening, friends. Meeting again in the session of Materia Medica. And since last two lectures, we are discussing about the big polycrest, which is acutely acting, having acute pace, that is the belladonna. We have discussed many cases about belladonna and we have discussed many aspects of belladonna from Alan Skinner. Today is the concluding part. But before going to the concluding part of this remedy, I want to share few things which are very essential because where you can grab the remedy in children basically. Both the cases of children and generally these cases happens to be there at the start of summer when these communicable diseases out of which measles, mumps, those are very common at the start of summer. And where you get this typical picture. So first case, it was way back, but I will share that case, acute case of measles. The child, just 3 years of age, male child, was brought to me and who was cranky enough. He was crying and crying, and he had a coryza cough and fever since one day before. And fever was very high grade. His head was very hot, and his face was absolutely flushed, red, and he was just crying and crying. Second important thing, he was gnashing his teeth during fever state. He was just gnashing. There is grinding of teeth that was going on. I asked regarding the two things, the thirst, because thirst is very important. And I asked, what about the thirst? And the mother told that since yesterday he has not consumed even a half glass of water. We are trying to give him, but he refuses. That is very typical with this. Second important thing, I have checked the pulse and pulse was full throbbing, bounding. It is full volume. That was another characteristic. And the dryness was very typical over there. Little bit rash appears over there on the body. A pinkish rosy colored rash was there on body, but not yet fully blown, and it was there. So whenever the fever without thirst, with high grade fever, with flushed face, with the bounding pulse, if it is there, it is very typical picture of the belladonna. Whatever may be the disease, whether it is measles, whether it is mumps, whether it is any type of viral fever, if this picture is characteristic, it is belladonna. And this is specifically in 3 years child, when it is there in fair looking child, then always think of belladonna first. So I have started him on belladonna 200, few doses I have given. I asked him to meet me tomorrow again. Generally, I used to call these patients, acute patients, daily. If the fever is there, I used to call them daily so that we can understand whether we are on right path or not. Second day child was what? Important thing was that his crying has came down. Fever was little bit better, but whole body has shown the rash. The redness was increased. It was typical maculopapular rash, more of a macular nature, and it was full-blown measles rash. When I asked to just, I checked the opened the mouth. I've seen there the coplic spots over there. It is full open case of measles now, and patient is on the path of recovery because now the skin symptoms came out, and which are very important for us. Fever was decreased, his crankiness has decreased. If it is there, it means your remedy has acted well. Better not to interrupt. Or if you want to give, don't give anything more than that, the same dose. Otherwise, no need. Generally not needed. So I asked them to come tomorrow again. And then I have seen him again. The fever was no more. Rash was there. And rash used to happen there for 4 or 5 days. And then it disappeared. And he was recovered completely from the episode with the help of belladonna, 200, 3 doses on. So this is very typical of the belladonna presentation, whatever may be the case. Another case in the similar month, there was a 4 years female child was brought with the right mumps enlarged. There is right parotid enlarged. Mumps was there, right sided mumps, which was very throbbing, and she became so cranky and because it was paining a lot. And she was just having a severe headache, might be. She was just putting her head on the some hard part. And that is very typical with this. Fever was there, marked fever, and with again with thirstlessness. And that female was crying or weeping a lot. Picture was as good as same, only the disease was changed. Earlier it was measles, in this case it was mumps. It doesn't matter whether it is mumps or measles. We are not prescribing for measles or mumps. We are prescribing for child who is of belladonna. We are prescribing for the child. We don't have to prescribe for the name of the disease. And that's why I have given again the belladonna here in this child. I have given belladonna 1 ml, 3 doses. And after belladonna 3 doses, the next day the throbbing was absolutely nearly about better. Swelling was there, but pains had reduced. And within span of 3-4 days, the child was completely recovered from the same. Again, even after the mumps, little bit rash appeared on the body and disappeared quickly within a day. This is a good indication of belladonna. Belladonna, we have a very typical presentation of a scarlet fever generally. And that scarlet fever is the characteristic of this belladonna. Their rash is having a typical rosy hue. I will share screen. How is the scarlet fever? Just look toward the thing. I will show you. Yes, this is the picture of generally of the scarlet fever. Generally, this rash is always having a rosy hue. This is scarlet fever picture. So one should not forget this. This typical presentation, if you are observing, keep it in your mind. Generally, it is macular rash, not papular. Macula is the thing which is beneath the eruptions are beneath the skin. They are altered in color. So this is maculopapular rash, which is the characteristic of the scarlet fever, and this is belladonna hue. So we must understand this. This is the thing with which you can catch the remedy. Measles, if you get such types of features, think of belladonna first, then rest of the remedies, because it is the important remedy for the scarlet fever. So these are two cases which I have shared, and this is common picture, whatever may be the disease, whether you don't label it measles, mumps, or any other viral fever, it doesn't matter. What patient presents about belladonna is the important for you. And this is what, in first case, the potency was 200. In second case, the potency was 1 m. It depends upon susceptibility. If the susceptibility is very marked, then you can go for high potency also, 1 m also. But generally, in acute states, I generally used to use 200 or 1 m very commonly in my practice. So let us go with the remaining part of the belladonna on page number 59 in my book of Allen's keynotes. We have finished up to the abdominal complaints. Let us start with the skin complaints of book. And what he presents in skin. Skin, a uniform, smooth, shining, scarlet redness. The redness which I have just shown you is the scarlet redness. That is typical of the scarlet fever. Dry, skin is hot. The burning, that is, skin is burning, imparts a burning sensation to examining hand. It is hot. Generally, things are acute. So 30 might be 200. It depends upon situation. You cannot fix it as this is the only thing. It depends. It varies from patient to patient. So skin is dry, skin is hot, burning, imparts burning sensation to the examining hand. Through the true Sydenham scarlet fever, just a picture of Sydenham scarlet fever, which I have shown to you. That is very, very typical. Fever with rash. The fever is high grade, associated with rosy hue of rash And generally, if thirstlessness is very marked, think about the belladonna. The headache is very marked, think of belladonna. The crankiness, shrieking is there associated, think of belladonna. Where eruption is perfectly smooth and truly scarlet. And these are the scarlet rashes which happens to be there along with the scarlet fever. So skin, you must know this typical view of it. Then what he says, the pressing downward as if contents of abdomen would issue from the vulva, ameliorated by standing or sitting erect, worse in the morning. Three remedies are there. The lilimtic, the murex, the sepia, these are all three remedies where there is bearing down sensation is very characteristic. In case of murex and belladonna, in case of murex and sepia, there is a very typical posture they take. They cross their legs in order to get settled and to prevent the peering down sensation. That is very marked with the sepia and murex. But in case of belladonna, the posture is different. They stands erect or sits erect. That is very typical in order to prevent the bearing down sensation. And that is a very characteristic of a belladonna. Here it has been not mentioned, but belladonna is also very important remedy for involuntary urination during coughing, specifically if it is acute one. During acute cough, the cough, sneezing, if there is a involuntary urination, one must think about the belladonna is an acute remedy in acute states. So we have finished literally many aspects of belladonna. Let us go with the relationship. Relationship is very important to know. Complementary is calcarea. Yes, definitely. Belladonna is an acute of calcarea. Generally, after belladonna, if patient settles, it is always better to go for calcarea. Calcarea covers the rest of the things and prevent the recurrence. That is very, very important. And that's why you don't have to repeat calcarea. It is 1 or 2 doses of calcarea, 30 or 200, depending upon child. You can think about it. Second important thing, you can go for even for sulfur as a follow-up remedy, good remedy, if the rash is persistent. And then instead of going to the calcarea, you go for the sulfur and followed by the calcarea. That is another thing which you can use in such types of cases in order to get complete cure over there. Sulfur is the remedy as per my knowledge of pathology, where what I used to teach and I have learned that sulfur is the remedy which is essential in order to complete the cure. Sulfur stimulates the resolution process over there, and because of which coming to the normality is very essential, and that role is played with sulfur. Belladonna is acute of calcarea, which is often required to complete a cure, similar to aconite, bryonia, cicuta, gelsemium, glonine, hyoscyamus, melilotus, opium, and stramonium. Generally, all are acute. Few of them are subacute, like bryonia and gelsemium. And the state, if you go with the stages, you can get the first remedy is aconite, second is parampos, third is belladonna, fourth is gelsemium, if you go with the range of inflammations. So this is one thing one must know. Then the general modality, the aconite, aggravation. Aggravation from touch. Sensitivity is very marked. The touch aggravates, the motion aggravates, noise aggravates, draft of air aggravates. Looking at bright shining objects aggravates, like in case of, as if in case of lysine also, stramonium also. Aggravation after 3 p.m., aggravation at night, aggravation after midnight, aggravation while drinking, aggravation uncovering the head, aggravation in summer sun, aggravation by lying down. Many modalities. Can we repeat sulfur in skin complaint dose? No, sulfur should not be repeated. Sulfur is very defecting remedy. You should not. If you are giving it in centesimal, just give 1 or 2 doses or 3 doses, not more than that. Should not repeat. There are many modalities in this remedy, and because it is a very acute remedy, and that's why many modalities comes out. It is very easy to catch the belladonna on the basis of modality. The amelioration is by rest, amelioration is by standing, amelioration by sitting erect, and amelioration generally in warm room. These are generalities of the remedies, general modalities. The inimical remedies, there are two inimical remedies to this. One is acetic acid and second is dalkamara. These are inimical. You should not use acetic acid or dalkamara before or after belladonna. So that you must add in your book that you should not use the acetic acid and dalkamara before and after belladonna because these are inimical. Generally, the action of this belladonna is only for 1 to 7 days. Very short acting remedy. It has acute pace and it remains for some time and it disappears. And that's why very acute presentation you can get with the belladonna. So literally we have learned the belladonna from many aspects from Allen's keynotes since last 3 days. Many cases we have discussed. And if we know the core of the remedy, then it is quite easy to prescribe this remedy. So these are the things which are very common in this belladonna. Few of the rubrics which one must know, which we'll discuss little bit. In Delusion bulls up, I think there is only one remedy, belladonna is there. Just open the repertory, find it out, Delusion bulls up. Yes, I think it is belladonna. What is bull?
What's a delusion? What's a delusion?
Bulls,
Cannot
B-U-L-L.
hear. Sir, you told
B-U-L-L.
some word.
B-U-L-L-S, bulls. Is it there? It is there.
यस सर है
है,
थेसिस
बेलाडोना
रेपर्टरी में
सिंगल है.
सिंगल हाँ
हाँ,
सिंगल
बेलाडोना
है
सिंगल है.
Single belladonna, sir.
What it means? What is delusion bulls? Bulls का मतलब बैल. In common language, to whom you call by the name of bulls? Who are literally not are doing the works only in a specific manner, who doesn't go beyond the limit, who used to do the same work again and again, and you call them what work you are doing like bullish. It is the sense which is there. If patient is not following properly, then this is very typical sense which you have to catch from that. Delusion bulls up. Patient who is there in front of you, you are telling him and he is doing yes, and he is doing it in the similar manner. He is not showing his own intense interest over there to go ahead. That is a feeling or sense which you have to catch. It is a bit a difficult rubric to be catched in specifically in belladonna. But one must know that belladonna is single remedy over there. Then there are few more rubrics are there. I cannot recollect it immediately, but just a minute. I will go through this. I will tell you the rubrics.
They act madly, no? Sir? They act in a mad manner, like tearing the cloths.
Yes, yes. There is one rubric called as unconsciousness interrupted by screaming. You're going to get the Belladonna single over there. Unconsciousness interrupted by screaming. Patient comes to you who is having the problem since 3-4 days, and he is having high-grade fever, he is having headache and everything. And he comes to you, you ask what you have done, what medicines you have taken. He said, no, I have not taken any medicine. Since how many days you are suffering? Sir, I am suffering from 2-3 days. Then why don't you take the medicine if you are suffering so severely? He says, doctor, it's okay, I was suffering, but I was not aware that I am suffering too much. Then you question, why do you are here? He says, I'm here only because today it is not possible. It is too painful today, and that's why I'm here. So it means that he was as if he was unconscious about his disorder since 2-3 days, and all of a sudden he comes to you with us because of pain. So unconsciousness was interrupted by the screaming, and then he knows, I'm having some suffering, and he comes to you. Single remedy, Belladonna. Very important state which you have to catch over there. This is what the actual feeling, actual state which you have to catch over there. So unconsciousness interrupted by screaming. Very important single remedy rubric of Belladonna. One should not forget. These states you can get many times in the patient. They are unaware about their suffering, and all of a sudden they comes to you and they say, doctor, I'm suffering from such and such disease since long time, but I feel it's okay, and I was not looking towards it. Today it's too much, and that's why I'm here. This is very typical of unconsciousness interrupted by screaming. So Belladonna, if you learn with the rubrics, there are many aspects of Belladonna which you can catch. So my suggestion is for you to read the Belladonna from the Shankaran sir's Soul of Remedies. You can learn a lot, many rubrics about the Belladonna, and you will get the mental state of a Belladonna, about the violent mania of the Belladonna also. So this is a wonderful remedy which we have covered in 3 lectures from Allen's keynotes. Go through the Boric Smart Remedica to know more aspects about the Belladonna, and tomorrow it's not possible to conduct the lecture. We'll meet directly on Monday with the next remedy. I think it might be a benzoic acid next time we're going to discuss. So that's all for today. Thank you being there. If any query is there, yes, definitely we'll have a talk, chat.
So they always tell after agonite we can give belladonna, but after belladonna we should not give agonite, like this. Some rule they are telling.
No, it's not related with the. It's not like that. It is if you are considering the stages of inflammation. If the inflammatory stage goes to the level of congestion and where you can observe the congestion, aconite is not of any use. In aconite, pain is the characteristic. Aconite presents the pain, the agony, the turmoil, tossing in agony, but where you cannot localize the congestion. So the sentence which, if you will understand, is very important. First stage of inflammation before localization, first stage of inflammation, that is congestion, before localization takes place. That is the sentence in aconite. And once the localization settles, then there is no role of aconite. You cannot use the aconite because it is past, or it is beyond the stage of aconite now it is. And that's why there is no, you cannot go back to the aconite. Aconite is the prior state of the belladonna. Is it clear or not?
Thank you, sir. Yes, sir. Yes, sir. Yes.
Any other query? So thank you being there. We'll meet again on the Monday. Thanks a lot and good night.